Well, it may be an understatement to say that this year has seen some dramatic changes in healthcare under the Trump administration and Health Secretary Robert F. Kennedy Jr. But advances in women's health are still lagging. One of the biggest moves we did see was the removal of so-called black box warnings by the Food and Drug Administration about the risks of hormone replacement therapy for menopause symptoms, saying the benefits outweigh potential risks for most women. We're going to discuss this and much more with Dr. Mary Claire Haver. She's an adjunct associate professor of obstetrics and gynecology at the University of Texas Medical Branch and an expert on menopause and all things perimenopause. She is also the author of The New Menopause, Navigating Your Path Through Hormonal Change with Purpose, Power, and Facts, and the host of the Unpaused podcast. Dr. Haver, thank you so much for being here. There has been so much going on in the women's health front this past year, and one of the biggest developments was that the black box warning that was added more than 2 decades ago was removed. I know you were part of that effort to remove that. Tell us more about why that was such a big decision this past year.
So the black box warning was added in 2003 due to the Women's Health Initiative study. And since that time, multiple factions of that study have been walked back. And what we know is that especially for vaginal estrogen, for local estrogen products, there should be no warnings whatsoever because it's not systemically absorbed. And when we look at the nuance of the actual data, having this black box warning was really an overcall. So for decades, we've actually asked the FDA through multiple administrations to have this removed, and so excited that finally this year we were able to get it. Now, there are warnings for all medications, as there should be. There are risks and benefits to all patients, and those are still in the labeling. But the big black box warning, which was dramatically overstating concerns, has been removed.
It is significant. And also there's a lot of nuance to this, right? I know we have discussed that previously. I also want to talk about the increasing attention on menopause in relation to heart and brain health. There's this new research that highlighted the impact of menopause on cardiovascular disease, visceral fat, and insulin resistance, bone loss, cognitive aging, and the risk of Alzheimer's. That's a lot. What more can you tell us about that?
So, forever the research on menopause focused on hot flashes and how to relieve them, which is an important aspect of menopause because they can be really life disruptive. But in the last, decade, research has really been trying to dig into what are also the cardiometabolic, the neurologic impacts of losing our estrogen levels. And what we found is there are estrogen receptors in every organ system of our body, and all of these organ systems are affected. So one of the great things about social media is women sharing their experiences. So for example, the discussion around frozen shoulder, the discussion around palpitations, the discussions around having tinnitus or ringing in the ears really has, led a lot of researchers to say, hey, we have tens of thousands of women complaining about these symptoms during menopause. Let's dig into the research and see what we can find.
And I love that perimenopause is finally getting the attention it deserves as a woman in her 40s right now trying to navigate what's going on. And it's, it's a real physical transition, one that affects mood, cognition, sleep, metabolism, and emotional regulation. Yet many women are misdiagnosed, told it's psychological rather than hormonal, and placed on antidepressants, or perhaps someone thinks it's perimenopause, but it's something else. But there's been almost no research on this. What's going on there?
True. So we are going to be publishing the new Perimenopause, the sister book to the new Menopause, early next year. And when I was digging into the research, so for pregnancy, for example, we have about 1.2 million articles with the word pregnancy in it. When you look at menopause, we have about 98,000, but when you look at perimenopause, we only have about 7,000 articles. Now, that being said, I am seeing day after day, I check the research every day of things that are published. Perimenopause is really starting to surge. I feel like we're about 3 years behind where we were with the menopause conversation. That perimenopause is really starting to get some of the attention it deserves.
As it should, right, in my humble opinion, because it can last, and this was a surprise to me, it can last up to 10 years. And there's research showing, I was shocked to learn that. And also that if you go on hormone replacement therapy in that time frame, that is really beneficial, right?
It can be, especially in the mental health space. Some of the most surprising research to me, but it really makes sense now that I just treat perimenopause and menopausal patients. One of the biggest findings we see is a doubling in the depression and anxiety rates across perimenopause. And so many women are finding that by stabilizing their hormones through the transition, they are having better cognitive outcomes and better mental health outcomes than rather starting them with a antidepressant or anti-anxiety medication first.
Okay, and this was also the year that the crisis in funding women's health finally broke through. And you were just talking about you're seeing more and more studies, for example, on perimenopause. There was this McKinsey report that found that diseases that mainly affect women, including women in menopause, receive far less research funding than male-dominated diseases. It found that federal investment is stagnating as the need accelerates. But Melinda French Gates committed $100 million to women's health innovation, which is very exciting. So overall, where are we on funding for women's health in this country?
So historically, it's not been great. You know, to quote Dr. Lisa Mosconi, women are owed centuries of research in diseases that primarily affect women, but also when we look at cardiovascular disease, women have heart disease differently than men. And, you know, we're underrepresented in studies, we're underrepresented in clinical trials for certain medications. And so we're just taking how the drugs affect men and applying it to women, and we're seeing very different outcomes. But the good news is that a lot of private entities are stepping up to start to fund women's health, because when we have healthier women, we have a better population overall. You know, women are the wisdom keepers. Women are, you know, at this time of their lives in their menopausal years where they are trying to be CEOs, run companies, you know, manage families. And when they're healthier and have better cognition and mental health, the whole population does better. So it's a great investment.
And to that point, more workplaces are making accommodations for women who are in menopause, right? Tell us about that.
We are. Right. So we're seeing large companies starting to add menopause benefits to their care packages, which could include, you know, helping, you know, we're underserving women in the menopause space because we don't have enough trained clinicians. So we're seeing investments in companies providing menopause care. We're seeing companies starting to provide more menopause benefits, time off, resources available. And so it's pretty exciting.
Yeah, it certainly is. All right, before I let you go, I also want to get your thoughts on how you think women could be impacted by the major cuts to Medicaid spending in rural communities.
You know, we already struggle across the country in smaller populated areas with having enough providers and enough expertise to treat women. You know, menopause affects all women if we live long enough. That's 51% of the population. And it's even in New York City, even in major metropolitan areas, it's difficult to find an educated provider. When we look in the rural areas, it's next to impossible. One of the things I think that is exciting in this space is that these telemedicine companies are being developed specifically to serve women in perimenopause and menopause. And I think that's going to go a long way to help women get the care that they need.
All right, Dr. Mary Claire Haver, great conversation, so important. Thank you so much, and happy holidays.
You're so welcome.